So now we will discuss question number 126 to 150 of the subject-wise test of pediatrics. So now we come on to question number 126. And question number 126 was, a baby presents on 12th day of life with icterus. The unconjugated bilirubin is 18 mg/cent. The following cannot be a possible cause. And the correct answer is option number D, that is neonatal hepatitis. Well, the correct answer to this question is neonatal hepatitis. Why? Because neonatal hepatitis is a cause of conjugated hyperbilirubinemia, and here they were talking about unconjugated hyperbilirubinemia. And the rest of the options that were given to you in this question were actually causes of prolonged unconjugated hyperbilirubinemia. So prolonged unconjugated or prolonged hyperbilirubinemia may result due to if there is a hemolysis going on as in G6PD deficiency. It can also result due to breast milk jaundice. It is also seen in hypothyroidism, or if there has been any extravasated blood as in case of a cephal hematoma. Or if there has been inadequate feeding. So these are the options that you should know, or these are the causes of prolonged hyperbilirubinemia in neonates. So basically in this question they were asking you about causes of prolonged, indirect way of asking you the causes of prolonged hyperbilirubinemia. So next we come on to question number 127. And question number 127 was an image based MCQ, and the question was, following is a chest x-ray of a child with a congenital heart disease. Identify the congenital heart disease of the child based on the typical appearance of the heart on the x-ray. So the correct answer to this question was option number D, that is total anomalous pulmonary venous return, or TAP VC as it is commonly called. So option number D was the correct answer of this question. And why? Because in this image, the image, if you see, the image of this heart resembles that of a snowman. So this image was, this heart shape is called a snowman appearance. Snowman appearance, which is seen in TAP VC. And what are the other congenital anomalies which can have typical X-ray findings? Well, in TOF or tetralogy of Fallot, you can have a Corin Sabo, the typical appearance, and in case of a TGA, it is egg on side appearance. So these are some other X-ray, typical X-ray findings that are seen in cyanotic heart diseases. So next we come on to question number 128, and question number 128 was, true statement about pyelonephritis in children is, and the correct answer to this is option number D, that is all of the above options were correct. So in pyelonephritis, you should know that it is an infection which is common in less than 2 years of children, and usually older children may have flank pain. But in younger children or in neonates, they may have non-specific symptoms which may resemble just like neonatal sepsis. And this should be suspected in any child who has non-specific symptoms, and it should be suspected in any child who is less than 2 years of age who does not have any localizing sign of fever. So next we come on to question number 129. And question number 129 was again a image based question whereby you were shown the image of a child with stained teeth, and the question was, a 2-year-old male is brought by his mother for his well child visit. He was a full-term product of a normal pregnancy and had a normal postnatal course with no hospitalizations. He drinks tap water supplied by them in your city. He was predominantly on milk-based diet, and a local practitioner had prescribed a syrup for the child, which he had been taking for the last few days. He is growing well and has a normal physical examination, only notable for black staining on the teeth. The most likely cause of this is, and the correct answer is option number B, that is iron staining. So you should know that intake of iron can cause staining of the teeth. Now staining of the teeth can be either intrinsic or extrinsic. So now intrinsic can result due to hereditary conditions of the enamel, the intrinsic staining. And the extrinsic causes include iron supplements, poor oral hygiene, or abnormal food habits. Now, it is because of this black staining that results due to iron supplements. It is usually advised to the parents that when they administer iron syrup, they should administer it a little behind in the oral cavity, and once the child takes it, they should give some water so that the syrup is cleared from the oral cavity and it does not cause any more staining. So that is about staining due to iron supplements. So next we come on to question number 130, and question number 130 is again an image based MCQ, and which says, an infant in the nursery or the NICU has shortened lower distal arms but with the presence of abnormal thumbs. Her platelet count is profoundly low and the X-ray is shown below. Which of the following congenital heart disease is this condition associated with? So the correct answer to this question was option number B, that is atrial septal defect. So what do you see in this X-ray? You basically see that the proximal bone or the humerus is normal, but there is absence of the radii, and there are the thumb is also abnormal. So basically this condition is, the diagnosis of this condition is thrombocytopenia, or basically the TAR syndrome, where there is thrombocytopenia and absent radii syndrome. So the TAR syndrome is what it is seen in this image, which is characterized by thrombocytopenia, absent radii as it is evident from the name itself, and there are abnormal shaped thumbs. And the cardiovascular anomalies associated with this condition can be either tetralogy of Fallot and ASD. So next we come on to question number 131, and question number 131 was, a 32-week-old baby is born to a 35-year-old mother after prolonged and obstructed labor. At birth, the baby did not cry and received bag and mask ventilation for 1 minute. Baby was transferred to the NICU for post-resuscitation care. At 56 hours of life, baby was found to be hypotonic and had developed seizures. What is the stage of his HIE? That is hypoxic ischemic encephalopathy. And the correct answer is option number B, that is he is now in HI 2. So basically from this question you would have judged that this child had birth asphyxia or perinatal asphyxia, So there was perinatal asphyxia in this child when he was born because there was delayed cry. He received bag and mask ventilation and he was then transferred to NICU for postnatal care. So there was evidence of perinatal asphyxia, and then at 56 hours of life he developed seizures. So now he has progressed to stage 2. So what is the staging of HIE? I will discuss with you the Sarnath staging, by which this child is classified into stage 2. So by Sarnath staging, HI can have 3 stages: stage 1, stage 2 and stage 3. And the parameters that are used are tone, autonomic function, pupils, presence or seizures, mental state, Moro's reflex, or suck reflex. So in stage 1, usually the tone is normal, while in stage 2, it can be reduced, and in stage 3, the child would lie flaccid. The autonomic function, it is predominantly sympathetic in case of stage 1. It is parasympathetic in case of stage 2, while the autonomic function is absent in stage 3. The pupils are dilated or in stage 1. They are constricted in stage 2, and the condition of pupils would be variable depending upon the clinical condition of the child in stage 3. Seizures are absent in stage 1, they are present in stage 2, and again the condition of the child is variable with regard to seizures in stage 3. Usually the child is hyper alert in stage 1. In stage 2, the child may be lethargic depending upon whether there was seizures or not, and in stage 3 the child is comatose or stuporous. Moro's reflex is strong in case of stage 1, it is weak in stage 2, and it is absent in case of stage 3. Similarly, the suck reflex may be weak in stage 1, it is weak or absent in stage 2, and it is absent in stage 3. So this is how HIE is classified into various stages as HI stage 1, 2 or 3. So seizures are basically present in stage 2 only. In stage 1, usually the child will not have seizures. So next we come on to question number 132, and question number 132 was, question number 132 was, IMR of India as per SRS 2017 is. Now IMR, and the correct answer to this question was option number C, that is 34. So IMR stands for infant mortality rate. And SRS stands for sample registration system. So as per the SRS of 2017, the infant mortality rate of India was 34. So next we come on to question number 133. And question number 133 was, which of the following is the most representative of the total subcutaneous fat up to 16 years of age? And the correct answer to this question is option number A, that is triceps skin fold thickness. Well, the skin fold thickness is indicative of the skin fold thickness is indicative of this subcutaneous fat. It is indicative of subcutaneous fat, and it is most representative of the total subcutaneous fat up till 16 years of age. And it can also tell whether the child is malnourished or not. So in normal children, the skin fold thickness may be up to 10 millimeters is taken as normal, while in malnourished children, it may reduce up to 6 mm. So this is also one of the parameters that are used for assessing the nutrition of a child. So next we come on to question number 134, and question number 134 was, a 3-year-old boy is brought for the evaluation of dry eyes and photophobia. So question number 134, the clues I will start writing: dry eyes and photophobia. He has some difficulty in adapting to darkness. He is a very poor eater and diet does not contain fresh vegetables or milk. Examination reveals dry, scaly skin and follicular hyperkeratosis on the extensor surface of the extremities. So dry, scaly skin on examination. And there is dry silver grey plaques on the bulbar conjunctiva. What is the most likely diagnosis of this patient? And the correct answer to this question is option number A, that is vitamin A deficiency. So you know you got enough clues in this question about when there was mention about dry eyes and photophobia, there was difficulty in adapting to darkness, and there is dry scaly skin, especially on the extensor aspect. So all this were pointing towards vitamin A deficiency. So you should know that vitamin A has a role to play in maintenance of vision, especially night vision. It has a role to play in maintenance of the epithelial tissues. And it has also a role in differentiation of various tissues, especially those involved in reproduction. And deficiency of vitamin A, the first sign may be difficulty in night adaptation, or the child may present with frequent falls at night. The patients may give you such a history that he keeps falling at night because he cannot see properly at night. So xerophthalmia results if there is vitamin A deficiency. So there is dryness of eyes, and Bitot spots may also result. Other findings apart from those seen in the eye, that there may be skin changes in the form of hyperkeratosis. There may be infertility because vitamin A is also involved in differentiation of various tissues, and there may be formation of renal calculi because absence of vitamin A may cause metaplasia of the epithelial there. So it can also result in renal calculi. So next we come on to question number 135. And question number 135 is, which of the following is not true about genetic counseling? And the correct answer is option number D, that is none. So what is genetic counseling? So basically in this question you were asked what is not true. So that means all the given statements that are given here are true. So you should know that genetic counseling includes giving the family information about the support groups. It also includes documenting the prenatal pregnancy delivery notes, and it also includes regular follow-up to motivate and give psychological support to the patient and his family. So what all things do you require to give genetic counseling to the parents or the family? So genetic counseling basically is a communication process which deals with problems associated with occurrence and recurrence of a genetic disorder in the family. So some important indications of genetic counseling are if there is a known or suspected hereditary disease in a patient or family. If there have been birth defects in previous children. If there is unexplained mental retardation, dysmorphism, or multiple malformations in a child. If there is history of consanguinity, and if there is identification of malformations in antenatal ultrasound. So these are the indications of genetic counseling, and once this has been done, so it is important to note down the prenatal history, the natal notes, and at the same time it is important to inform the parents and the family about the prognosis of the child and what treatment is available, what research is going on, so that they can be apprised of any new treatment modalities that may be available in the coming future. So next we come on to question number 136, and question number 136 was this again an image based question, and it asked, this boy presented with noisy breathing, stiff immobile joints and mental retardation. What can be the probable cause? And the correct answer to this question was option number B, that is Hurler syndrome. So question number 136, answer was Hurler syndrome. So you saw in this image, in this image the child had coarse facies or features of gargoylism. Which amongst the choices that were given to you are present in Hurler's syndrome, which also has mental retardation and joint stiffness? So next we come on to question number 137, and question number 137 was, the following is not a feature of Pierre-Robin syndrome, and the correct answer to this question is option number B, that is brush border iris. So Pierre-Robin's syndrome it is a sequence. So what do you mean by sequence? A chain of events of certain developmental malformations entailing the next. So there are three main features of Pierre-Robin syndrome, and there is micrognathia. There is a large tongue which often falls back, which may cause respiratory distress or obstruction. And these patients also have cleft palate. Amongst the there are certain other anomalies as well, and amongst the ear, otitis media is one of the most common anomaly or problem that is seen, which can often result in hearing loss. So next we come on to question number 138, and question number 138 was a particular genetic disorder that is passed from generations to generation only from the mother to offspring is, the correct answer is mitochondrial inheritance. So question number 138, option number D, mitochondrial inheritance is the correct answer. So whenever a disease is transmitted from the mother, only from the mother to the children, then it is mitochondrial inheritance, because the mitochondria are present only in the ovum. So what will happen is, an affected mother will affect all her children, but the affected daughters will transmit the disease, but the affected sons will not transmit the disease. So that is how a pedigree would go. So this question can also come to you in the form of a pedigree chart, where you can see that all the children would be affected in one generation if the mother is affected, but in the subsequent generations, the sons will not transmit the disease, but the daughters would transmit the disease to their children. Examples of mitochondrial diseases are Lake disease, and a condition known with the acronym of MELAS, which is known as mitochondrial encephalopathy, lactic acidosis, and stroke. So these are examples of diseases which follow a mitochondrial inheritance. Next we come on to question number 139, and question number 139 is Shidak-Hayashi syndrome is characterized by, and the correct option is option number A, that is oculocutaneous albinism, recurrent infections, so Shidak-Hayashi syndrome is an autosomal recessive disorder that arises from a mutation of a lysosomal trafficking regulator protein that leads to decrease in effective phagocytosis. And so this condition results in oculocutaneous albinism, recurrent infections, and it also leads to peripheral neuropathy. So these are the important features of Shidak-Hayashi syndrome. Next we come on to question number 140, and question number 140 is, the proliferation, differentiation and survival of immature hematopoietic progenitor cells are governed by, and the correct answer is option number C, that is both A and B, that is both interleukins as well as colony stimulating factor are responsible for the growth and differentiation and survival of the immature hematopoietic cells. So besides regulating the proliferation and differentiation of the progenitor cells, they also help with the proliferation and differentiation of the mature cells as well.